I'm Grace Cangemi, and I'm here with Anna Little, who is running for the primary line, I guess, for the congressional seat in District 6. I'm doing this in the interest of full disclosure. Art Gallagher and I spoke. Art is very close to you.
Yes.
So he felt that it was inappropriate for him to interview you. He said it would be way too close, and he wanted somebody a little bit more removed, which I am. Of course, we know one another through various political issues and times, but certainly don't have the relationship that you have with Art. So, in the interest of full disclosure, that's what's going on here. Mm-hmm. And welcome, and let's get started.
Sure.
You are looking for the nomination in District 6?
Absolutely. Yep.
Okay. And let's start. I thought that we would separate this into some background information and then move forward. I know some people know your resume, but some people don't. Political accomplishments, personal accomplishments?
Well, I'll start with personal. I'm married to my husband for 18 years. We have 3 children. They are ages 17, 16, and 12, so they're getting older. I'm the littlest little these days because they're all taller than I am. And we live in the same town that we work in, within District 6 in Borough of Highlands. Politically right now, I'm serving as mayor in elected office. I'm finishing my first term as a mayor. I've been in elected office for roughly 9 years now. I was first elected to a council position and then went to freeholder.
Yes.
I was a Monmouth County freeholder for 2 years, in 2006 and 2007. I've won 4 elections. This would be my 5th. And I'm looking forward to representing my neighbors and my colleagues in District 6.
Okay, and professionally you're...
Professionally, I'm an attorney. I have an office in solo practice in the Borough of Highlands, practicing in immigration law,
okay,
which makes me very well equipped to handle all of our enforcement issues nationwide. Okay.
That's exciting, and certainly something that we'll talk about as we move forward. And of course, the first step in the process is the primary process. So we're looking at sort of seeing who's going to get the line for the primaries in the 2 counties that are relevant to your race.
Right.
And I'm going to get right to the first issue, which is money's a factor. It's a factor in really both the Monmouth County races in 12 and 6, because we've got a very similar situation, an attorney and a mayor looking for the nomination against somebody who's a self-funded, wealthy individual. What kind of a factor is the war chest in your race? What does it matter?
Every election, you have the same questions in every election. In this particular race, the war chest could be divided. I mean, I know that my opponent in the general election would be seeking perhaps a senatorial seat. And so I don't think the war chest is for a single election. But putting that aside, realizing that he does have that at his disposal, should he choose to spend it, I think $1 million is a fair amount of money to spend on a campaign. I think we can be very effective in both the primary and the general. I'm willing to reach for double that. But my opinion with regard to campaign fundraising, I'd like to explore that a little bit, if you'll let me.
Please.
I believe in a grassroots campaign. When we're running for office, getting out the vote is the purpose. It shouldn't be the purpose of a candidate for election to be seeking a seat for status or for power. You're a representative. You're doing a job for the people. So if you want to know if you're the right person, if you want to check yourself, you need to have people supporting you. What better way early on to ensure that you have that support than to collect money from grassroots fundraising efforts?
Okay, and certainly that's true, but can't you reach more people with more money?
Yeah, you can't get your message out unless you raise money. There are 2 formulas we're using in this campaign season. One deals with maximum amounts. One deals with $100 amount. Mm-hmm. Okay. The maximum amount under the FEC that can be contributed by a single person to a candidate is $2,400. It has to be personal funds in a federal race. Mm-hmm. Cannot be corporate funds. Okay?
Yep.
All right. You can have in-kind contributions from issue-specific organizations. And that's the model we're going to use for this campaign. We like to bundle those maximum contributions in groups of 10.
Okay.
We are reaching into the business community. We're reaching out to medical professionals, which makes perfect sense this campaign season, and any individual who wishes their freedom and their liberty protected.
Okay.
We have a running list of people that we're contacting. We have pledges. The money is coming in. On the other end, with the $100 contributions, we have a cute formula. 100 people, $100, 100 times.
Okay.
And that's $1 million.
And that's $1 million. The question becomes, however, you have to put a lot of effort into fundraising, which Diane Gooch would not.
True, but my effort into fundraising is also my effort into getting out the vote. And if Diane Gooch does not have to fundraise, she's going to have to get out the vote.
Okay. Now, you talked about issue-specific donations and in-kind contributions.
Mm-hmm.
Issue-specific. Let's start with healthcare.
Okay. Doctors and nurses, hospitals, they're all very frightful about this healthcare bill that's pending down in Washington right now. It's socialized healthcare. There just is no other way of describing it. It would be submitted to government, healthcare would be submitted to government control. It's necessary if you're going to have taxpayer dollars involved or government oversight involved. We seem to have evolved to a situation in this country where we are socializing the entire operation. We have got the poor with welfare who are dependent upon a handout. That handout comes from the government. It's taxpayer dollars, therefore the government must oversee the handout. We have a gap between that handout and being able to make enough money to support yourself without the handout, and that's because of income tax. We have employers who are taxed as corporations or as employers separately. There are capital gains taxes. All of this keeps the economy down. We're now going to do a similar thing with healthcare. We're going to say either comply with this bill or pay a fine. It's another tax.
Of course.
Okay? And it keeps things in that industry from growing. It stifles the industry. And the doctors already know this. They've already been through it with managed care. Managed care keeps costs down, but it also undercuts the profitability of the medical office because they must be part of this managed care group in order to receive the insurance card. The patients, the consumers, they don't want to use a doctor's office without using the insurance card because their employer is paying for that for them, and so why would they pay for something that they can get without paying? So what's happened is in a pediatric office, it is no longer a profitable endeavor to give a vaccination to a child on a well visit. And I know that because I have a cousin-in-law who's a pediatrician and I've spoken to her about it. I've also spent time in her office. She loses money with every well check. Unless the child is sick, she can't make money. That's wrong.
What does need to be done in terms of the healthcare? What needs to happen?
We need to let some competition into the industry. There was a time when we could walk into a doctor's office and write a check. There's nothing wrong with that. We could purchase an insurance policy individually if we chose to do that. And we had the freedom of choosing which insurance company we wanted to purchase a policy from. There were no requirements to be within a certain provider through employment. I think that obligating employers to provide insurance is adding a cost to the industry doing business. The difficulty for the employer is profitability. If he's not profitable, he's not going to offer a job. If there's no chance of that profitability due to this healthcare bill looming, he's going to be less inspired to offer that job. We're in an economy where we need those jobs, and government's not going to create the jobs. The employer's going to create the jobs.